I want to talk about that. Why have the communities of color been so adversely impacted disproportionately from the rest of the population when it comes to COVID-19?
So what I would say is we know that there have always been health care disparities. Basically, what that means is healthcare disparities, they affect adverse groups of people who are systematically experiencing greater obstacles to healthcare based on racial, ethnic group, religion, mental health, gender, and then cognitive sensory issues as well. And they have had this other characteristics that are historically linked to discrimination and exclusion. So when we think about what the CDC states as far as people who are at higher risk of getting very sick from this disease, is older people with serious chronic medical conditions, typically heart disease, including hypertension or high blood pressure, diabetes, and lung disease. These are more common in the African American community, right? So those are the things that they're seeing that can contribute to that. I know the famous Dr. Fauci has said that it's not the case that African Americans are getting infected more often, rather that the prevalence of underlying medical conditions such as diabetes, hypertension, obesity, and asthma has led to higher intensive care admissions and death rates among the African American community. I mean, with that being said, we're all at risk, but we can tell that we're more at risk of being more ill from getting the COVID-19 or coronavirus.
And let's talk about some of those issues in these communities, because there's a lot of mistrust and sometimes suspicion about things, or just a lot of distrust there. How can we work to build that back up?
Well, one of the things that we can do is continue to do community outreach events to not necessarily normalize the conditions, but more give them more information about what hypertension, diabetes is, or asthma as another example. Because a lot of times in our community, if we don't feel it, we feel like we're fine. So we even dismiss symptoms that should prompt them to go seek medical attention, and it doesn't happen. We rather seek our own home remedies, or we can sleep it off to say, okay, I'll feel better in the morning. And then next thing you know, some of these cases that we see on TV, they end up passing away in their sleep due to such things as COVID-19, due to respiratory distress. So giving out that information, having with the community events such as African Americans to say that, hey, I have this too, but then this is how I manage it as well, that will help with the situation that we have at hand. I think the more that we're out there and the more that we're prevalent out in the community, then they know that we're there for them as well. Hopefully we'll put them at ease to want to go ahead and get their regular checkups, to get their comorbidities in line, and trust their doctor or their healthcare provider, so we won't end up in this predicament later on down the line such as this.
And a lot of times too, Bridget, I think they need to see providers of their color, right? Representation, right? So I think when you have that, you can probably, because there is that whole fear, of not in trust. No, we don't have to trust in our medical providers, because that's, years and years in the making. So educating, awareness, and having the representation of, us out there in the communities and giving this information. And we have to advocate for ourselves, right? So we have to be out there, and it's giving them the information in order for them to make, educated or, decisions about, how they want to, tackle these things in their lives. Because we all know it's in the medical profession, like hypertension it's a silent killer, right? Because you go for, years of having this high blood pressure, but you've got these symptoms that are kind of very vague, and we can always make excuses for them. So being, educating them, having them be more aware of their bodies actually, and what's going on with their bodies, and encouraging them to have those conversations with their providers.
And when we look at, some of those, risk factors, and you touched on it, maybe it's access to healthcare or sometimes not going at the first onset of things that probably need to be checked out. Talk to us about, how to approach this COVID-19 and knowing which actions to take when it comes to making sure you get the care when you need it.
Well, as far as in the community, as far as African American community, that as far as financial needs, that's going to be a little strain within the community. So if you don't have a PCP, you should reach out to to the healthcare departments to make an appointment. There's community health centers as well. That's low income or free, as a matter of fact, to get treatment, and you can start there as well. Urgent cares is another place where you can go. But I think going to the health department or community health centers is a great start, because not only will you be able to be treated, but it will tell you where to go to get treated for COVID-19, but you can also establish a professional patient relationship and continue on that treatment for your other comorbidities that one may have. So I think having established that relationship first builds on the trust. And when saying that I trust my provider, if he or she provides me this, or if I have to go get labs, I trust that provider because they know that I need to have this. It helps build that relationship so that they can continue on with the care and hopefully improve and get better overall.
And I also think by starting at those places as well, because they have tons of other resources. So maybe it starts out, you're going to see them for healthcare reasons, but there may be that you have financial concerns, and there may be resources that they may have there as well. So I think that would be, having the community centers, going to the health department, because they have different resources that are available that, normal people may not have, that information at hand. So I think that would be, if you don't have your primary care physician established, those would be the excellent places to go. But I also think we got to start off by educating them. What are some of the symptoms? When we talk about COVID-19, I know I let Tasha kind of go into the symptoms of those things, of what to kind of look out for. What are those things that, I may have this, and what should I do about it?
So we've seen a lot of symptoms. We've seen a lot of different ways that this has played out. I have a friend whose extended family in the household, they've had some varying symptoms, even though they both tested positive.
Right. So the symptoms vary from an individual to another individual. So with the common symptoms that you see displayed on TV all the time, such as the fever or greater than 100.5, the chills, the fatigue, the muscle aches, that's general symptoms that you would see broad spectrum, right? But then there could be some other symptoms. You can also have the headache, the chest pain. The dry cough is another common symptom, but not everybody has it, right? So in addition to that, you even seen some patients with pink eye, like they say they had pink eye, and then it leads to the cough, and then which leads to the fever. Also seen patients that had GI symptoms, nausea, vomiting, and diarrhea. So, what happens is that because these symptoms are vague and it's not like in a genie bottle to say this is what it is, we are contributing those symptoms to other things, such as allergies, sinus infections, or I may just have a stomach bug, or I may have ate something last night that just didn't agree with me. And you want to dismiss those symptoms, and just gets progressively worse. So, and especially if you have someone that's in a house that has COVID-19 and you're seeing their symptoms and then you're looking at yours, and if it's not mimicking the same thing, you may dismiss it and thinking that it's something else. And that's what I've seen the community do, is that we're dismissing it and trying to say that it's one thing when really it's really COVID-19 and they have not gotten tested for.
So when it comes to testing, like, where do you think we are on that? What do people need to do moving forward, regardless of ethnic background?
Well, first of all, I would say don't avoid care. Go call your primary care physicians, call your healthcare provider for guidance. So you know your body, right? So I can't tell you that, this one specific symptom is for everybody. You know your body. So if you know that, hey, this is not the norm for me, reach out to them. Don't go and get seen. You need to be getting that information from your healthcare providers, especially if you're a high risk population, right? So if you have those other comorbidities, heart disease, diabetes, lung, asthma, different things like that, those symptoms, you can't just self-medicate. Those things that we normally do with this COVID-19 is not going to work, and it's just going to be progressively getting worse.
We want to get into the community and be hands-on right there, so there's no excuse as to why we shouldn't get tested. And if you do get tested and come out positive, or more or less you have symptoms and yet you try to just dismiss it, you need to have an advocate to say, hey, listen, you really need to come in to the doctor's office, or I'm going to take you to the ED, and we're going to go ahead and get this addressed regardless of what it is. Being extra precautious is never a wrong thing around this time.
What has been, have you been seeing people not taking it seriously enough? Just because as we move toward reopening, many people are anxious to get back to routines. How can we continue to take this pandemic seriously in the Black community and abroad, and, to try to protect our health as we move, further into the future here?
Well, I would say, I think we have to continue to be smart, right? Doing the basic things, washing our hands as often as possible, sanitizing them. Don't touch your eyes, your face, your hands. Cover your mouth when you cough or sneeze. And also, I would say continue social distancing as much as possible still. Wearing a mask when you're in close contacts with others. I've seen on social media and the internet how we've had these holiday gatherings, Easter gatherings, or I see people having these quarantine parties. We need to avoid unnecessary gathering as much as possible, and I think, staying home when you're sick. If you're sick, you need to stay home, because not only are you, at risk of, infecting others, but your health is very important too, and your family, right? And then I would say, we have to take it serious by, taking our vitamins and taking our health back into our own hands, doing those things that's going to help to reduce our risk for, not only COVID-19, but also the other comorbidities that we talk about, meaning, hypertension, diabetes, and other lung disorders and different things like that.
Okay. Well,
and I also think too, in addition to that, in addition to what she just said, again, is that cultural thing that we have, that if I don't feel it, if I don't see it, then everything's okay. And so if the person doesn't look sick, then that means that that person is okay for me to be around, or for me to go to a party, or for me to be outside and doing close contact with other people when it's not necessary. It's one thing to have to be close to people if you're at work or whatever. It's another thing to where you choose to be in gatherings that's more than 2 to 5 people, or even 10, and you making that choice to be there, knowing that there's a possibility that someone can come in contact with that. So I think we need to change that norm. And also too, when you see the news that the cases are dwindling down, our numbers are decreasing, people are not dying as much as they were in the beginning, they having treatments, possible treatments to treat the virus, we then get this pre-notion that, okay, well, even if I do get sick, my chances of making it is far more greater than for me being stuck in this house and not being able to do the things that I did on an everyday basis. So that preconceived notion sets us up for failure when we're seeing these things on TV saying that everything is getting better and, oh, it's going to be all right soon. And especially if the governors and the politicians are saying, well, we have to open up for economic reasons, and it's getting better, it's safer out there. And so if they're saying that, then obviously that I don't need to go outside with a mask. I can go and have dinner or have drinks with friends, or I can go to this party and I should be okay.
But I would want to also add to that is the reason why the numbers have been improving, because we have been so diligent about doing social distancing, staying at home, and doing the other things that has brought those numbers down. So when we look at that, yes, we've done a great job at the numbers coming down because of the things that we're already doing.
Mm-hmm. Well, I love this, and I just want to touch on, some more of the wellness advice that you give the community, because mental health and taking care of yourself during this time, because there are so many stressors right now, whether it's the financial stress or the family stress, and worrying about not just your health but just all these other things that have been taken off the normal routine.
Well, exercise is one to help with the mental stress. I mean, mental illness is a big thing. And one of the things that I am happy about as a healthcare provider is that we're not stigmatizing mental illness anymore. We can say that and not feel bad saying it. So saying that you're stressed and you have anxiety, or you have financial strain and it's causing a discourse in your family at home, it's okay to say those things to people. So making it as normal as we have been, it's okay to go ahead and call up a friend or tell your PCP, or if you have insurance, it's always on the back of your card to say if you are suffering with mental illness, or questions about anxiety or anger or whatever, call this number. And it's a helpline that will take you step by step. But beyond that, what you can do yourself is, like I said before, exercising. The best way is about 30 minutes, 5 times a week. In addition to that, having a healthy balance as much as possible when it comes to eating your fresh fruits and vegetables and your lean proteins when it comes to meat. And I know that too can be difficult, but if you follow people on social media that has community stops, like the Healthy Bus Stop that has the $5 filler bag with fresh fruits and vegetables. That way, the expense of going to the grocery store and having to spend all that money on fresh fruits and vegetables, knowing that it doesn't last long, you have to eat all of that, right? Is another way. Reaching out to people, even asking if there's even such things, so that one can tell you where you can go or where to search for that, is another way to help with that financial constraints when it comes to buying healthy. Because when you buy healthy, that means it's more expensive. I can go to McDonald's and I can get a $2 meal and I can be just as full versus eating something that costs me $10 to $15 for that meal because I want to eat healthy. Drinking plenty of water, staying hydrated is very important. Because if you do get sick and you do come down with COVID-19, one of the issues is dehydration, because you don't have a desire to drink, you don't have a desire to eat, and being dehydrated can lead to detriment further down the line. Getting adequate sleep and rest is important, and that can play a factor, because if you have anxiety and you have fear, some people still have fear going outside. You have people who don't have no fear at all, and then you have some that do have fear, and that in itself can lead to you having inadequate sleeps or broken sleep patterns. And even with us as healthcare providers, we take our risk every day taking care of patients because that's what we love to do. But it does not mean that we too are immune from the anxiety and fear. I have that every day when I take care of my patients. And going to sleep and get an adequate amount of sleep is very difficult for me to do. So I know if I'm having that issue, I'm sure others are as well. And meditating and, prayer always helps. When you're by yourself, while you're taking a shower, taking your 5 deep breaths and meditating and praying, help ease your tension a little bit. May not take it away, but at least you can probably continue on your day. And you can do that throughout the day. All day. You don't have to have a specific time. God hears your call at any point in time. So you can do that too. And also don't forget to take your vitamins. Taking your vitamins is very, very, very important, especially during this time. We need those every day.
Let me just kind of piggyback on one thing that she says, because, my background is oncology, but one of the things that I always talk to my patients about is the fear of the unknown. We all have that. When we don't know, and there's a lot about this disease that we don't know, is that fear there. And that is normal, right? It's just when that fear kind of takes over is where we're coming to where we get our problems. So one of the things that, I also talk to my patient about, stress and anxiety causes sleep disturbances. Just like she says, if you're not getting adequate rest and sleep, your immune system is affected by that, right? Yeah. So that is a huge part with this. We want to have a healthy immune system. So, talking to your friends, talking to your healthcare providers, because there's things that we can do to suggest to kind of help you get through these times, and it's not that we don't have that stigmatism anymore, because we are, mental health is a huge issue now, and we're able to openly talk about it. So people are not as afraid to say, hey, I'm having a problem, but you got to talk to somebody. So if you're having the issues and you're not letting your friends, your family, your healthcare providers know, we can't help you. So that would be my biggest thing. And again, I would also say develop hobbies. One of the things that I've been doing now is word search. I got this huge book that I'm going through and doing word search because, that keeps your mind going too, right? And then, of course, I just, want to make sure that people are checking on their family members. Check on your mothers, your grandmothers, your friends, and just, reach out to them, because that typically will help you as well by, knowing that they're okay, hearing their voice, or, having that connection there too. So those are the things, going forward. And I think when we talk about healthy living, that I would just kind of add into what Tasha said.
Especially with the bouncing. Oh, sorry.
Oh, I wanted to touch on what Black Nurses Rock is doing to help support the healthcare community and the community right now.
Well, one of the things that we have done as of right now is that we but we have made masks to pass out to donate to local hospitals. One of the hospitals that was donated yesterday was Orlando Health downtown. So one of our members donated the masks to the employees down there at this time. And then we also made them for Advent Health to the colleagues there. So we partners with both. In addition to that, we wanted to give some of the masks to the Orange County schools, in particular Jones High, so that they have a magnet program, a medical magnet program that we have been doing mentorship collaboration with. And so we wanted to donate masks to them as well. As soon as they get back to doing clinicals and simulations at Advent Health University, school, college of medicine, or whatever, they can be able to wear their masks while they're out and about and learning how to take care of patients and things like that.
The other thing that we do, we have been doing and continue to do, is we are part of a lot of different community outreach events and programs, right? So we highlight and educate on healthy hearts, diabetes, hypertension and blood pressure, and also HIV and AIDS awareness. So we are still out there in the community and being a part of those things at these different, health fairs and different things like that. So that is, one of the things that we do pride ourselves as being out there in the community. So whenever somebody asks, can you guys come out and help? We're not just there to do blood pressure. We're actually there to educate and kind of give our professional advice. And also, again, it's that having that relationship to seeing someone, that you can relate to in the communities. And I think that's what Black Nurses Rock Orlando does really well.
It's been painful, it's been hard, but there's so much we can learn from this moving forward to try to heal. What can you say about that?
So I would think, as far as the healing part, this has forced us to kind of slow down, right? And kind of look at things a little bit, because our day-to-day has been disturbed. I think as we get more information and more data about, COVID-19 and, the effects and how, long-term things like that we can look forward to. But I think coming up with the vaccine and treatment is really going to be the, what's very important for us to kind of move on past this, because I think that will definitely calm some of the fears that people are having now, because we don't have that. Once that is developed and it's available, I think that's how we definitely kind of move forward and just continue to do the basic principle. I mean, this is something that we as nurses and healthcare professionals have done and, continue to do, but now it's more readily, available for everybody to know, hey, these are things that are important for us to do and kind of follow those things. So I think, this has been a hard and difficult time for us all, but I honestly think there's so much for us to gain from this, and then to move forward with. Just, even having those relationships with your healthcare providers, I think that is the biggest thing right now that I could see that has benefit from this whole COVID-19.
Yes, and just knowing that they're doing vaccine trials right now as we speak should hopefully help ease some of the tension and anxiety of when this is going to end. And they're also just in different hospitals throughout the U.S., they're doing different drug trials to see what works. Okay, that didn't stick, let me try this one. Oh, okay, it worked in this group, let me try that same treatment plan for this group. So we don't want to say that this one particular drug works and really it doesn't. So just saying that doesn't mean that it's going to happen. But actually putting in the work and actually gather the research to say, hey, this is what works 75% of the time or 90% of the time. Let's go ahead and implement this right away. Should help reassure not patients, but the community out there to say, hey, we're diligently trying to work and come up with something. Just be patient, follow what the governors and politicians are saying, the health experts are saying, and keep social distancing as much as we possibly can, and try to wash our hands as much as we can, and to practice the safe social distancing as much as possible until we can come up with a solidified treatment. I think at least with that should help reassure and ease some of this anxiety.
Can I ask you what it's been like for you all personally, and how, your group has helped you, support each other, and your colleagues are supporting each other?
Well, we communicate on a daily basis within our group on Facebook. So we have a Facebook group where we send what you call messages to go ahead and to motivate each other to keep going. Sometimes we post things about our family members who have passed away from this, and then we send our prayers to each other. In addition to that, we have exercise with a few of my Black Nurses Rock sisters, and that helps really alleviate anxiety, and also helps with the camaraderie of it all. To say, hey, even though we're apart, we're still together. So it's those things that we have done. Is there anything that you have done with the Black Nurses sisters?
No, I think that's basically it. It's just that let each of us know that we're not in this all by ourselves. We're all in this together, and that encouragement and those encouraging words that we give to each other on a daily basis is welcome. There are some of us who are not working. Maybe they have been put on redeployment in their facility. So those are different anxieties as well. So we not only as healthcare providers, but as our families and everything as well. Some of us are going out there and coming home and are fearful of, oh my gosh, have I been exposed today? Am I going to expose my family? So we just encourage each other and know that we are not in this by ourselves. So we do have our sisters and we have each other there.
I think that the masks are here to stay for a long time to come.
I do. I honestly do.
I think the mask will be here until we get a vaccine and get people comfortable enough to even want to take the vaccine. So that's another thing. We can't get people to take the flu vaccine. I'm wondering how it's going to be when this COVID-19 vaccine comes out. Yeah. So yes, until we have the vaccine, I think the masks are going to be here to stay, to be highly suggested, because even now you can go outside and you can see people not wearing masks.